The member for Chisholm has the call.
Thank you, Mr. Speaker. My question is to the Minister for Health. Will the Minister please update the House on the global state of the coronavirus pandemic and how the Morrison government's response plan and domestic vaccine manufacturing will help protect Australian lives and livelihoods?
The Minister for Health.
Thank you very much. Thank you very much, Mr. Speaker. And I want to thank the member for Chisholm, not just for the question, but in particular for her support for mental health, but also for Chinese Australians in the early phase of the pandemic, when there were many challenges that that community in particular faced. The global challenges remain. We are fortunate in Australia today. One new case reported, announced by New South Wales yesterday, but no additional cases in either New South Wales or Queensland following on from the single case in each state which was announced over the weekend. Those measures which they are taking with our support are helping to ensure that containment continues. So far, across Australia this year, 0 lives lost. Today, there are 0 people in ICU or on ventilation around Australia for COVID-19, and there have been 44 days without any cases this year. At the same time, the global pandemic continues. We've seen over 37 million cases this year alone, over 850,000 lives lost. And whilst the numbers have dropped significantly since mid-January, sadly we've seen an uptick in the last week. And so we need to be ever vigilant. And that's why our plan, in particular, of containment, of testing and tracing and distancing on top of our borders has been fundamental. But we also have to continue with the vaccination program. In particular, we've so far ensured that 437 aged care facilities have been given potentially life-saving vaccinations. 40,000 aged care residents have been given potentially life-saving vaccinations. 164,000 Australians, and those numbers are growing every single day. But fundamentally, without the source and supply of 1 million vaccines a week approximately from CSL, a decision we made in August of last year, Australia would be in a difficult position because we know that global competition is intense on a scale we've never before seen with regards to vaccines. And despite that, we've been able to bring numbers into Australia and begin that program, to see that ramp up, to see that growth, to see those lives being protected. But as we go forwards, as we bring on board a sovereign vaccine manufacturing capability, the likes of which is available to few other countries, we give ourselves the capacity to vaccinate the nation, to provide that certainty and to provide that pathway out. That is about saving lives and saving livelihoods.